After the advent of the new constitution, Kenya saw the birth of 47 county governments, a devolved structure that brought power closer to the people. However, this also meant UNICEF needed to innovate a new approach for working with the county governments, especially in the supply of essential commodities to health facilities.
Originally, UNICEF worked along with the central government, but coming with the devolved government structure, the challenge was that we have now 47 plus 1 counties, independent structure.
Individual county governments have been using multiple parallel systems to procure and send medical supplies to their hospitals and dispensaries. Some of these systems pose challenges of inefficiency in deliveries. There is currently no integrated health supplies management mechanism for the delivery of essential medical and other commodities to health facilities.
We asked ourselves exactly how do we engage the counties at the counties level to ensure that we have quality supplies for the children through the procurement supply chain.
In 2014, UNICEF entered into a memorandum of understanding with the Kenya Medical Supplies Authority (KEMSA) to create a drugs and medical supply chain. The agreement is focused on the delivery of procurement and logistics services, capacity optimization, and sharing of knowledge. In this spirit, a procurement services awareness workshop was held in Naivasha, organized to sensitize stakeholders on the benefits of taking advantage of UNICEF and KEMSA's established capabilities in supplies management.
With KEMSA, with the health officers for health from those counties, and the donor communities we have working along with KEMSA, try to strengthen that drug and medical supply chain in KEMSA, to identify gaps and see how collectively as a team we can be able to impact, to provide solutions.
The workshop brought together senior health officials from 16 of the most impacted counties who held candid discussions with government officials and development partners.
We can only accomplish the objectives that we aim to accomplish in the health sector, widely speaking, if we work together as one. If we work in our own as KEMSA alone, or the UNICEF alone, or World Food Program alone, you'll be able to reach one corner on one section of the country, but there will be many gaps. But if we come together and join hands, we'll be able to achieve the overall objective. And therefore, we want to be part of the group, part of the team, other than a Lone Ranger approach.
Pirko Hainonen, UNICEF Kenya's acting country representative, has continued to stress the importance of making quality deliveries in time for the most vulnerable children.
Those children who are severely malnourished in a village in Turkana, they cannot wait for a month, for 2 months for the essential ready-to-eat supplies. The same is for vaccines, ORS, antibiotics. They need it today.
UNICEF has a thorough, expansive procurement system that has worked in many countries. KEMSA has 8 regional warehouses, and through its comprehensive supplies management system, it is also the only organization that has a harmonized tool for collecting information of how medicine and other supplies are consumed.
Well, the program basically was looking into, first of all, create awareness to all the participants about the possibility of engaging with UNICEF procurement services, but in a way that was a collaborative tool to use in case we should be complementing KEMSA's services in regards to procurement and supply chain management to the counties in Kenya. One of the main objectives of the workshop was not only to actually create the awareness, but receive feedback, especially from the field, especially from the new created counties, in regards to the challenges they are facing in procurement and supply chain management of health products and services.
The key is to understand and integrate the two systems. These interventions are already bearing fruit. KEMSA, with support from UNICEF, has been able to establish a more efficient nutrition supply chain that reaches areas like Turkana, where there are high malnutrition rates. Susan Imoni is a nutrition officer in Kolokol Health Center in Turkana and is happy nowadays to be receiving frequent supplies of nutritional supplements.
Sisi tunapokea kutoka KEMSA, wanaleta pamoja na madawa hiyo zingine yenye ya kutibu, pengine dewormers, tuna deworm hata watoto, saa zingine tunapatia vitamini A.
I must commend UNICEF and KEMSA for their transformational strategic partnership aimed at improving healthcare supply chain.
The proposal to have a unified supply chain via UNICEF and KEMSA's strengths brings hope for millions who are in dire need of medical, nutritional, and other supplies. This is indeed an opportunity for the government, through support from UNICEF and other partners, to provide better healthcare for the children in Kenya.